Only on CBS Mornings, we are revealing a massive new push to make COVID vaccines more accessible, particularly in poor parts of the world. And it involves a familiar face. Academy Award winner Charlize Theron is teaming up with the Ford Foundation to fight vaccine misinformation and inequality. And COVID vaccine rate is less than 4% in Africa, where she was born. Theron told Jonathan Vigliotti how her organization, the Charlize Theron Africa Outreach Project, is helping.
As a fellow woman, I feel so inspired.
Charlize Theron's Africa Outreach Program has been fighting to prevent the spread of HIV/AIDS among South Africa's adolescent population since 2007.
Have members with your organization spoken with those on the ground in South Africa who are hesitant to get those vaccines because of misinformation that they've heard?
Yes, I mean, we've seen misinformation with HIV, so it's not new to us. It's in finding that right community-based health worker that will be able to sit down with somebody and speak to them in a language they understand, and they know her because they see her down the street.
Theron is now channeling her organization's grassroots network in the fight against COVID. Just 14% of South Africa's population of 60 million is fully vaccinated.
We have to remember that we're talking about families. When we see the devastation that COVID-19 has caused us personally here in America, it's so much worse in countries like South Africa.
The global pandemic has exposed how public healthcare systems are failing marginalized populations. Only 1/3 of the promised doses of the vaccine have been delivered to Africa.
These viruses will not go away until we actually look at social injustices. We value certain lives more than others. And until that goes away, we will never get to the end of diseases like HIV or COVID.
We're about to walk into one of our mobile clinics that's working in this area today.
I don't know how not to be an optimist. If I didn't think that there was hope for any of this stuff, I would just stay in bed because I love my bed. That human spirit that we all have, how you see people survive things that are unimaginable is what gives me hope, because I've seen people come out on the other side, because we can do this. We actually can.
For CBS Mornings, I'm Jonathan Vigliotti in Los Angeles.
In a Time op-ed today, Theron and Ford Foundation President Darren Walker called on world leaders to take action. Darren Walker joins us right now. Darren, good morning. How are you doing?
Great, thank you.
Thanks for coming. Now, President Biden says the U.S. will send more than 1 billion vaccine doses to other countries. Is that enough?
No, it's not enough. While we're encouraged by the administration's urgent call to action, we need more vaccines delivered to the developing world. So 1 billion is a great start, but we need a multiple of that number.
What more can the U.S. do?
What the U.S. can do is to work with the other G20 nations to organize a collective action to mobilize the financing. This is going to take tens of billions of dollars. We've got to come up with the financing for that. We have to work on the supply. We have a challenge of creating enough vaccines for the rest of the world. And finally, we have to work on distribution. Once the vaccines land in a country, that doesn't mean that they're going to be distributed equitably to all communities. So we have to focus on all three of those dimensions.
Is that what the $15 million in Ford Foundation grants is going to be doing, what you just laid out there? And will any part of it go toward addressing vaccine hesitancy, which, of course, is not only a problem here in America, it is in other countries as well?
Absolutely. Vaccine hesitancy is a major challenge. Misinformation and disinformation and across the African continent is real, just as it is in the United States. And so we'll be making grants to grassroots organizations. It's one of the things that we've been doing with Charlize's foundation, working with grassroots. This has to be a grassroots and a grass tops strategy.
I'm looking at you and Charlize, Darren, a new power couple, I'd say. Did she reach out to you? Did you reach out to her? How did this partnership come about?
Well, I first met Charlize 5 years ago in Durban at an HIV conference. Both the Ford Foundation and Charlize's foundation have been working on AIDS and HIV for well over a decade, and it was really through collaborating on that work. Many of the same grassroots organizations, community-based organizations working on HIV and AIDS in Africa are the same ones working now on vaccines.
What frustrates you the most as we sit here today? You know, I always marvel that here in this country, we still have people that won't take the vaccine, and you look at other countries that would kill to get what we're having. Despite all the misinformation and disinformation, people still want this vaccine, and we're just sitting here watching it pile up, aren't we?
Well, what frustrates me the most, Gayle, is that today there are millions of doses of vaccines sitting in refrigerators in Europe, in the United States, and in much of the developing world. People are desperate to be vaccinated. And so the inequality, the global inequality that is manifest in that reality deeply troubles me.
Do you feel like people of influence, or shall I say, individuals of color in positions of influence are doing enough to speak up for what the vaccine can do for this country?
I think as Americans, we've been focused on our own country, and that's understandable. But we are quickly, finally, making tremendous progress. So we now ought to be able to turn to the rest of the world. We are known, Americans, as the most generous people on the planet. So let us be generous in this moment.
And it's bigger than COVID-19, isn't it? You say we need to look beyond COVID-19 for future issues.
Absolutely. The reality here is that we cannot inoculate ourselves and believe that by being vaccinated in this country, we are immune. Because the rest of the world, if we don't see, we've seen with Delta. Delta came from another part of the world where there was a prevalence of non-vaccinated people. We're going to see the same thing. The experts tell us there will be new variants if the rest of the world is not vaccinated.
All right. Well, we appreciate you sounding the alarm, Darren Walker. Good to have you at the table. Thank you.
Thank you.
Thank you so much.